to introduce you to our host today, Dr. Erin Stokes. Erin Stokes, ND, is the medical director at Innate Response and a registered naturopathic doctor in the state of Colorado. Dr. Erin Stokes received her naturopathic doctorate degree from Bastyr University in 2001. Shortly afterwards, she began to pursue her passion for educating others by teaching Western pathology and psychology of healing at Southwest Acupuncture College. Erin combines her experience as a naturopathic doctor with an extensive background in the natural products industry. Her personal mission is to empower people with the inspiration and tools to change their lives. Welcome, Dr. Stokes.
Thank you, Kurt. So happy to be here.
In addition, we welcome Kevin Lamberg, Training and Education Specialist for Innate Response. Kevin has 16 years experience in the nutritional supplement industry. His conviction that good nutrition is the cornerstone of health fuels his passion for sharing his nutrition knowledge. Kevin educates listeners with a powerful blend of science, professional experience, and personal commitment. Welcome, Kevin.
Thanks, Kurt.
Now I'm going to pass it over to Erin to start the discussion.
All right. Well, thank you. Thank you, everyone, for joining us today. We're so glad you're able to make it to our discussion on advances in probiotic therapy. Now, as we all know, this conversation really all starts with the human microbiome. And we've been hearing a lot about the human microbiome lately. I'm sure that it's a focus in your clinical practice. And we know that microbes are impacting so many aspects of our physiology. They affect metabolic functions, help protect against pathogens. And reading that I recently did, I love this phrase, they educate our immune system. So there have been some major large-scale projects to try to characterize the human microbiome, just understanding what a direct connection it has to health and wellness. Many of you are probably familiar with the NIH-funded Human Microbiome Project here in our country. And then there was also a large-scale project in Europe called the European Metagenomics of the Human Intestinal Tract. And these have given us a lot more information about the microbiome, as well as the importance of probiotics in our clinical practice. So with prior Q&A sessions, you may have joined us before, and if you have, welcome back. Generally, Kevin, my colleague, has sort of interviewed me, and we've done a lot of Q&A. We're going to kind of turn things around since Kevin has done extensive research on probiotics and the microbiome, and I'm going to be interviewing him today. So looking forward to our conversation. Kevin, I think we can go ahead and get started on our first slide.
All right, sounds good. Thank you, Dr. Stokes.
Sure, you got it.
Yeah, so the first slide goes through 6 major points on what to look for in a probiotic that we're going to be talking about today. And we'll actually start with the first one, which is glass bottles. So a lot of times people ask the question when they're searching for a probiotic formula, what's one of the more important factors? You know, is it making sure that a product can be refrigerated, or is it glass bottles? What should I really look for? And one of the things that's oftentimes overlooked, even though it seems simple, is how important glass bottles are. And this is because we know by looking at some of the stability tests, as well as just looking at how probiotics are activated in the body, that moisture a lot of times is more damaging than temperature. Now that's of course within reason. I'm not saying that you can put your probiotic in the on your dashboard in the middle of 100-degree summer heat and think that's going to be okay. But what I'm saying is limiting moisture is perhaps one of the most important things when you're looking to preserve the activity of a formula. And that is mostly because when they're exposed to a moisture environment, it begins to activate the actual bacteria within the product. This is one of the reasons why Innate Response really uses glass bottles, and we believe that they are superior to just a plastic bottle because plastic essentially breathes. And
did plastic in our home and actually usually drink my water out of a glass bottle, even when I'm off to exercise or whatever. But I think the amber glass is really important too, because I like
Correct.
that you're not having that exposure to light. So you've got the glass combined with that amber glass. It's just always seemed like a good choice for me, not just even with probiotics, but in general. And I think that's an interesting concept because many practitioners are, of course, I mean, hip to BPA free and some of the other compounds that can be contained in plastic. And now there's also this factor with our probiotics that it's breathing, which is fascinating to me, and particularly in a humid, if you live in a humid climate, could be even more of an impact.
Correct. And one of the things that's sometimes overlooked, not always, but patients will, when they get home, begin to take their probiotic, and they may leave the cap off with the bottle exposed to the outside air, put the cap back on, put it back in the refrigerator. And the problem with that is the condensation forms within the bottle. So that is a huge consideration when it comes to preserving what are known as colony forming units, which is essentially the activity of the product. And it's very, very important.
Right. Good. Well, that's, seems very simple, but a really important topic. Here's our next one. And this is one that I hear people talk about all the time. And certainly have had patients ask me questions as well as other practitioners. And that's really surviving the stomach. And we know that specifically we're talking about the stomach acid, more efficiently and properly termed as hydrochloric acid, and also just other gastric juices. And so it's just curious to me that we look at this, and I'm wondering, what are your thoughts around surviving the stomach?
Well, we know that the stomach is a harsh environment, very, very low pH. And one of the things that a lot of companies will do is they'll enteric coat their product because of the concern that, the actual, whether it's the genus and species are going to be destroyed as they make their way through the stomach and then into the small intestine. So they have to encapsulate them essentially. One of the things that's, I think, really an important consideration when you're formulating a product is to look at the strains in specific. So we know strains like Lactobacillus acidophilus, which is commonly used, has not only a long history of safe human consumption, but it's demonstrated excellent adhesion to human epithelial cells as well as excellent resistance to stomach acid, which is really important when it comes to adding a different genus and species into your product. Just in case you didn't know, you also find this genus and species in a lot of foods, namely kefir and yogurt and sauerkraut. That's typically where it's found. Also,
Kevin, just quick thought. Being a naturopathic doctor and looking at nature and food, there's always been that question in my mind, I know, and now we have the specificity of looking at specific strains that can survive. Is people ate foods and have been eating foods with Lactobacillus acidophilus, for example, and other probiotic species for many hundreds, really thousands of years. And we know that somehow they survived the stomach acid, right? Because we see that traditionally. So it's great to have the modern research. And then it's also when, enteric coating became such a trend, there was also something around food and certain species being able to survive. This is what they've been doing for a long time.
Correct. Yep. And then we also look at the lactobacillus because they're very popular. Some of the ones that you typically find, especially within the Innate product, are the bulgaricus, which is shown to be resistant to low pH of the digestive tract. Also the casei. This is typically found in some of the fermented veggies, some of the meats and cheeses and milk also, which can resist a low pH. And also the plantarum, which you typically find in like sourdough bread. Another great strain that actually can resist some of the low pH conditions. Another genus and species that's typically used for women's health issues is the Lactobacillus rhamnosus.
Yes.
And you find this species within breast milk typically. And some of the in vitro studies that have been done on it has shown that it is resistant to low pH conditions, and it has an excellent adhesion to human epithelial cells, specifically in vitro studies. So this is a form that we utilize within our product. The Salivarius, same type of thing, resistant to low pH conditions. And then the Bifidobacterium longum, which you, again, find in breast milk, is resistant to some of the low pH conditions. Speaking of this too, one of the products that we have, the 514, is traditionally used for younger children over the age of 5. And part of the reason for this is because it contains some of those really important bifidobacterium strains that can be extremely helpful for younger children. Some of the ones I just mentioned, as well as the Infantis, which is exceptionally good for younger children as well.
Yes.
So
I think I've shared with you that my 11-year-old son takes that formula every day.
Mm-hmm.
Love it. And I think, when we're talking with people out in the world, with our patients around choosing, often, they're going to go with our recommendation. And when we're choosing, and I talk to people, they're trying to choose the right probiotic. Often they get focused on how many billion. They want to know, it's like that sort of bigger is better. And really, the potency is very important. But just as important, if not perhaps more important, is who's in there. Right? Who are the players? What is the formulation? Who are the specific players? Meaning, in this case, of course, the specific species, and how are they together? In this grouping. And so I think it's that shifting that conversation to having the right strains in there. In the
I
formula.
agree. Yeah, I totally agree. And with the strains too, you mentioned, non-competing strains, which is extremely crucial when it comes to putting together a formulation. The last thing you want is a product that actually, when it gets activated, goes against itself, and then, you get less of a product as it activates. The other important piece is, does it have a long history of safe human consumption? With some of these genus and species, the ones that we're using, we've researched that, and it's been shown that they do, which is very, very important. And making sure, again, I've mentioned this a minute ago or so, but making sure that they can adhere to the human epithelial cells within the gut is very, very important. Just to mention too, like with a lot of people who take high amounts of not probiotics, but antibiotics, you typically find some of these individuals can be deficient in vitamin K because it affects the large intestine, which the large intestine, as you know, produces vitamin K. So
absolutely, yes.
So when it comes to, we all know the importance of vitamin K, so making sure that you have a product that can help to hopefully replete the not only the small intestine but the large intestine is crucial. All
right, but let's move on to number 3.
Yeah, so this question comes up a lot, and it's specifically about, does the product need to be refrigerated? And it's kind of a tricky question, but not really. And I'll explain. So refrigeration really is ideal for the Innate product. Mostly because...
And for most products, right? I mean, it seems like refrigeration, when you're dealing with probiotics, is always ideal for optimal potency and viability of the species.
Well, especially if you're dealing with a product that has multiple genus and species, because
yes.
There are some that are more delicate than others when it comes to temperature. And one of the things that we do is we guarantee the potency and the viability of our product, especially these most sensitive strains, and guarantee the label claim for the colony forming unit count. So if we make a claim when we say 5 billion CFUs, then we want that to actually be true. One of the other things we do, which is very unique, is that we add additional products. So it's an intentional overage, as I like to say. And the reason why we do that is because we know life isn't perfect. And you may have a patient who takes the product and leaves it out, or there is obviously a transit period that goes on where it's not refrigerated for a period of time. And in order to make sure that we meet the label claim, we have to add a little bit of overage within the product. You typically have patients that ask, well, what if I carry my supplements to work, or I take them during the day and I'm traveling and I can't refrigerate them? Generally speaking, it's okay. Just make sure you put the cap back on after you take it, because again, the humidity is huge. That's a big consideration. And also, I mean, you don't want to keep it in a hot car and leave it there. Put it in your purse or take it with you, and don't leave it in a hot environment if possible. But generally speaking, with what we've done as a company, we've actually looked and done some tests ourselves. So we've shipped product, and then we've exposed it for a period of time to high temperatures, and then we've tested it to see how it holds up, and it does hold up, which is very good to know.
That's important to me that we've done that testing and taken that extra step to ensure that. And, I know myself that I will take enough of my flora on vacation with me for a week, say, and put it away in a little container. And I feel really good about taking it. And it's important to me to keep that consistency of taking it, particularly when I'm traveling, whether for a vacation or, for work. I travel at least once a month for work, and I'm always making sure that I have my flora. It's one of those, those things you double check right before you walk out the door. So I think it is important to know that for a limited period of time, you can go ahead and take that with you. I usually pull some out and take it with me.
Yeah, the shipping tests that we did were conducted during the summer months. So we specifically chose some of the hotter locations. This includes like the Southwest and Florida regions. And we use that, to actually measure whether or not they stayed viable over a period of time. And we did find that it actually does stay viable, which is very, very good. It's very good. And it also proves kind of what I was saying before. It's not temperature alone. It's also humidity that really makes a difference as well. So, and that can be a little bit better controlled in those situations. So,
all right.
Move on to the next one.
Yes. So variable strengths.
Hmm?
This is an interesting one. We talked at the beginning about the Human Microbiome Project, and we're learning so much more about the diversity of the different species. In fact, we know that healthy adult humans usually have more than 1,000 species of bacteria. So everything from diet, medication, age, where we're living, this is not one size fits all. And so correct. You mentioned, for example, the Flora 514, that is a favorite formula for children ages 5 and up. Also, keep in mind for sensitive individuals, maybe people who have not been taking probiotics, just are extremely sensitive, perhaps elderly folks. But we do have a whole range of different potencies available, just really understanding that the practitioner is the expert out there to help find the best one for patients.
Yeah, and that's a really, really good point. With a lot of patients, first of all, it depends on their medical condition as to what to use and what's best for them. Also, it depends on age. Like there are some circumstances where you don't want to use a product for specifically children under 5, in terms of using it maybe after a course of antibiotics, it may be wise to use a higher dose, like our 214. That may be for a shorter period of time, maybe for a 14-day period, and then change over to a lower dose, like a 50-14. Many practitioners actually build up because they find that patients do better when they start at a lower dose, and then they move through the ranks. So they may start them at a 5, and they may move them to a 20, then a 50. And that actually, they find better efficacy with that sort of approach. It is interesting because, I was astonished when I was reading some of these studies that showed that the number of bacteria within our gut is enormous. There's at least 500 different strains, if not more. And the number of bacteria can exceed like 10 to the 14th power. So when you think of that, and many of those strains are actually not good strains. So when you're dealing with strains that are, potentially pathogenic, it's really about a balance, and the body's able to create that balance and maintain homeostasis with this, balanced microbiome approach. So what I'm getting at with that is, when you're looking at a specific patient and you're looking at, what their microbiome or their specific situation is, you have to have multiple strains and multiple choices in order to choose the best or make the best choice for the patient in order for them to get well. So, and Innate does offer that. So we offer variable strengths within our product line.
Good, I like it. Let's talk about prebiotics.
Absolutely.
Okay, so prebiotics. There's been a lot of question around this. Do your probiotic formulas or our floras, do they have prebiotics? Why not? And we leave prebiotics out of our formulas for a reason. We really believe that food choices can serve as the fuel for the gut. We know that prebiotics, of course, are non-digestible fiber compounds. They definitely can be found in foods such as garlic, onion, beetroot, jicama. And we also want to bring into the conversation, Kevin, you mentioned a little bit earlier, the importance of also including fermented foods such as sauerkraut and kimchi. So we believe that food choices can serve as fuel. We also know that for certain individuals, particularly sensitive individuals, there can be issues with fermentation and gastrointestinal distress when you're putting in what may be high levels, honestly, of prebiotic, even if we don't consider them high. They may be if it's not something that this person's really experienced or that they're getting in their current diet. And so there can be some issues with this. And so we leave prebiotics out and encourage people to practitioners, of course, to educate their patients about food choices.
Mm-hmm. Many practitioners prefer it that way. They prefer the flexibility to be able to add in food choices that may contain, like, some of the prebiotics, maybe there's some of the short chain fatty acids or whatever it might be. And many times they find it's a healthier way to go. A lot of patients, as you mentioned, do react to FOS, fructooligosaccharides, or inulin in some cases if their gut is not where it should be, and that can be a real big issue.
Yes. So last but not least, let's talk about the purity of the product. I think that's really important. So many of the patients that we work with, we may be working with them on their food allergies. Maybe they're discovering different food allergies or sensitivities, or they may suspect them. They may just not want to get dairy, say in a probiotic formula that they're taking every single day. So I like the fact that we are soy, dairy, and gluten-free, Kevin, and we're not just saying that based on our ingredients, but of course we're tested. And so practitioners just really want, when you're choosing a probiotic, just the purity of the formula, the facility, the testing that's done. As many of you know, we have an internationally certified lab in-house that does testing for purity and potency. So this is an important aspect. And, as practitioners, you're really the trusted expert, the trusted advisor for your patients. And of course, they are looking to you for the decisions. And so this is absolutely a crucial consideration. Absolutely.
And Food State, in Innate Response in general, routinely does test for using ELISA for milk allergens. And this includes like casein within the product. And we, within the amounts, it's a very, very minute amount that's allowed. So very, very small. The product itself, is cultured, from a master cell bank, and that's how it's produced in general, or at least some of the genus and species are. And then what's done is it is centrifuged to clean it, from the growth media, and then it's tested using this process. So.
All right. Well, let's take a look at some of what we have. This just gives a visual. So I know sometimes I'm a visual learner. So when people are talking about 514 and 2014. Just to let everyone know, for those of you that might not be as familiar with Innate, the 14 represents the broad spectrum of 14 different species. This is our signature Innate flora blend. And then the numbers at the beginning refer, of course, to the potency. And
Correct.
So these are the different options that we have available. And speaking of different options, I know, Kevin, we had so much great content for our conversation today. We didn't get the chance to get to many questions, but we do have one question that was sent in advance. And thank you to the practitioner out there that sent this in. And this is a good one, because I think this is a question that addresses something that we hear a lot about. And it's, must a client really switch brands or go to a different type of probiotic intermittently, say every 6 months or so? Is it important that to switch things up? And what do we really know about that?
That's a really good question. Yep.
It's a good question, right? Because I think I would imagine there's a couple practitioners, if not many practitioners out there, kind of nodding their heads like, yeah, I've heard that. I've heard that maybe, your body gets used to this blend. But, the fact of the matter is, I can say personally, as a naturopathic doctor, I have not seen that in my practice. I certainly target my formula to the specific needs of the person. And if their needs change over time, of course, I will change what I recommend over time. But I don't just switch it because 6 months has happened or a year. And I know that there's really not any research, at least that we're aware of. And I know you've delved into the research substantially, Kevin, that there's not really any research out there that we've been able to find to warrant that switch.
No, most of the research looks at the individual strains, and then it, tests something specific about the strain to see, what the efficacy is. And, that's where the published information comes from, or how it's done. Not so much in terms of looking at switching things up and seeing how it impacts the microbiome. But I would be interested to see a study that's done like that, to be honest with you.
Yeah.
That would be interesting. So.
And there's more to come. I mean, we're seeing so much. We're just scratching the surface. I see it as kind of the tip of the iceberg. I think we're maybe just learning about the tip. I think this is such a dynamic conversation. I think that you and I should probably do a part 2, because we are out of time, and want to respect all the practitioners out there, and knowing that you need to get back to your practice. But thank you so much to everyone that joined us today. And thanks, Kevin, for our conversation.
Yeah, thank you very much.
All right. Take care, everyone.
Bye-bye.